definitely want to hang out with you one day, but I don't want to hang out with you while you're at work at the ICU. You write about amazing things, including your latest book, Prevention Over Prescription, trying to keep people away from the ICU. I want to make that the topic of our conversation today, and some of the things that you talk about as far as lifestyle modifications that can help me not visit you in the ICU. But before we do, remind us why you decided to practice medicine, and tell us what you found when you got into the field.
Great question. So the reason I wanted to get into medicine at a high level was to alleviate suffering. I was a pretty sickly kid in Edmonton with bad asthma, and my pediatrician was my hero. The way he would enter a room, put his hand on your chest, put his hand on mom's arm, saying like things were going to be okay. I really appreciate what he would do for us in terms of feeling safe and feeling that we were going to get through whatever condition we were presenting with. And so this is what I wanted to offer to people and to bring to people. And I liked, I was very drawn to ICU because it just suited my personality. I don't like predictability too much. I want to be able to work on my toes and think creatively to try and come up with solutions. So ICU really suited my personality. You also work as a team. I love it. And what you would soon realize, especially during the pandemic, is that a lot of our patients, unfortunately, were arriving due to lifestyle choices, and those choices are not easy to overcome always. Like sometimes it's socioeconomics, sometimes it's culture, whatever it might be, but often it was related to lifestyle choices. And when you realize that if you were to modify those lifestyle choices and to encourage this healthier existence, the landscape of healthcare could be transformative, not only for that individual, but for us as a society. So I just got like when you realized, especially because you weren't learning this in medical school, that you could reverse somebody's type 2 diabetes and get them off their medications altogether. When that message sat with me, and it was just this huge epiphany that like, okay, we got a mission now. Holy cow. Like if we really work on this, we could change how we approach health altogether. And so this has been the big driver. That was a big driver of the book. All our platforms really is to empower folks saying, hey, you could do this. You could get it on a healthier path, and we'll help you do it. And we'll make it cleaner, less complicated, because honestly, Casey, I don't think it's as complicated as it can appear to be, especially when you look at your social media feed and so on. So that at a high level is why I do what I do and what drew me to medicine.
Okay. I ask everybody in emergency care this question. At first, I was very astounded by the answer. And since then, it's really striking how consistent the answer has been. So you're in the ICU, it's slightly different, but it's related. What percentage of cases do you see in the ICU are related to metabolic health versus what I would imagine people would be going into the ICU for, which would be more like some type of trauma?
Yeah, good question. So the literature will say around 50% would be related to strictly metabolic syndrome. I'd say around 50% when I've looked this up.
Okay. Wow. That's actually a little lower. The answer that I get most commonly in emergency care is somewhere like between 80 and 90. So that's actually a lot more than I would have assumed. Now,
Yeah,
I
I think
also assume there's a lot of comorbidities that go along with some of the acute care, right?
yeah, like yeah, so once again, like I mean, it'll be a little bit site specific or where you live, but for example, at one of our sites, it's a trauma center. So a lot of those patients is nothing to do with metabolic syndrome. Another site is primary cancer. We see cancer patients and people with like lymphoma, leukemia. Often it's not related to metabolic syndrome. So there are conditions for sure that do not tie, but I'm just being as conservative as possible, saying 50%,
Okay.
because you know if I were to like, I just finished a week of ICU. If I think about it at a high level, walking through right there is for sure was greater than 50%.
Okay,
Yeah.
interesting. Wow, yeah, that's so sad. And so pandemic happened. You guys had a much more severe kind of shutdown up in Canada than a lot of places here in the United States. And you've been, being banging this drum for a long time. I met you at Low Carb Denver 2023. You've written your books. You've done your podcast. How do you feel like this message is being carried forward? Do you think we're making progress, or is it still much slower than we would like?
I mean, in general, I'm an impatient person, so it's slower than I would want it to be. But is there progress? For sure. I've actually been very encouraged about the progress because you're getting more and more people seeing the benefits of these lifestyle choice adjusting their lifestyle choices. I've never in my career had more people approach me saying, "Hey, I want to eat healthier. I'm thinking about exercising more, and how can I achieve that?" I just feel like there's some momentum there, and even the latest changes to the food guide in terms of a food pyramid, in terms of emphasizing protein, minimizing processed food, that's awesome. Like that step alone is acknowledging that we had work to do and we that making these steps is important. I That to me is clear sign that progress is happening. So this is this is why I'm so excited to be in the space right now, because we can make a difference and it will be significantly impactful.
Awesome. Yeah, I love your optimism and enthusiasm about that. I was going to ask you about the nutritional recommendations. When the day it came out, I saw it on Twitter, X, and it looked so cartoonish. I thought it was like fake. I thought somebody had made it up or something. Like, this is going to be another South Park episode or something. And turns out it was real. We talk about how the guidelines really impact places where we're feeding people. So, for example, prisons or schools, and in particular hospitals. So if you look at the picture of the reverse pyramid where it is now, you see a big giant steak on that top left. Like you're saying, dude, that is amazing, amazing, amazing progress. That there's even a picture of butter somewhere on there is like incredible. So I love that. When you read the guidelines, there's still like a cap on saturated fat, and there's a few things that probably didn't change as much as we would want to. What is your opinion about how the new guidelines might trickle down into where you will see it the most in your own hospitals?
That's a good question. I think all this will be slow as molasses. Like I think it's all this is going to be very slow to adopt, unfortunately. And I also think because of the politics of who and what administration is bringing this on board, there's going to be more antibodies and more resistance to make that change. And I hate this. I hate that because it should be about data and truth, not who delivers it, right? Like that's what it's all about. And I think I think some of this recommendations unfortunately are expensive relative to what we're doing in hospitals right now. My hospital has recently made a change to think of food as medicine. So they brought in one of our most esteemed chefs, Stephen Beckta, and he's developed a program where you're getting real food, high in protein, nothing processed, and really looking at ways that we could get our patients in a better state. And to me, this is super exciting. I'm hoping I'm hoping this will be the norm. This is I haven't seen it much in other places and other hospitals, but my faith is that once you start to hear those results, publish those results, normalize it, that it'll just trickle down to being the norm. And honestly, as patients, expressing like this is what we want, this is what we expect, not these, I don't know. Like I'll never forget one of the worst things I've ever seen walking into a room and I saw this guy that was diabetic that had pureed French toast on his plate with and had the syrup and all this stuff. And I'm telling myself we could do better. We can do way better. It's
That's
not only
insane.
is the texture disgusting, but this is not
Yeah,
gonna make
it
you
sounds pretty
heal.
gross.
It
I have
was awful.